This is my client who has, can I borrow your arm and hand, please? Who has pretty good flexibility throughout. You can see that she gets a little bit of hyperextension in the elbow. It's not severe, you know, it's mild. And I wish I wasn't the cameraman, but I'm the only one here today. All right. So I blame those part-time employees who don't work full-time. That's a joke there. All right, so she has, you know, 90 degrees of MP extension, and you can see, my gosh, look at that. That's really amazing. Look, that's incredible hyperextension at the distal IP. Now at the proximal IP, she has some hyperextension, certainly more than me, but up here that's astonishing. So this is a person who, through heredity, has, you know, laxity, at least in the distal structures. What really caught my attention a year or so ago was the fact that she had good mobility throughout the pelvis when I did spring tests, and she had good mobility along the lumbar spine, and I always screen the whole body. It's a habit of mine. She had good mobility in the ribs, and what really caught my attention was the fact that her thoracic spine has virtually no accessory motion, and I am certainly putting a considerable amount of pressure, more than would be normative. And if I cross over and I do the rib, you can see the rib indents, the rib moves. And if I use that same amount of force, there's nothing. And here you can feel that I'm, you know, doubling and maybe even tripling that force. This is like a steel rod here to here. So I just wanted to document this, and if we ever get an x-ray to see it, would be very curious. She did have a lower pelvic x-ray, and I don't know how much of the lumbar spine was captured there. But of course, it wouldn't have captured the thoracic spine, so that would be meaningless. A chest x-ray or a standard thoracic film would be very informative. So I just want to put this on the database and see if we learn anything down the road. That's it. Thanks.